So the Centre works in partnership early and throughout, more productively with communities and with community partners to another level, pushing the boundaries within the university sector and within research. And so what we want to do is see what can we do in partnership with the power that we have in a fight for more equitable access to mental health care, better experiences within mental health, as well as better outcomes.
So my name is Helen Marasha and I'm the Development Director here at Big Kid, and we're a youth charity. We work with young people that are at risk of exclusion and youth violence. We have a mission to end youth violence in London. We've had a relationship with the researchers from King's for a number of years, probably about coming up to 10 years I reckon, and so they've been on this journey with us and we've done a lot of learning from each other. That relationship has taken many different forms, I think, along those 10 years. We've recently done quite a number of events with them to talk about young people's mental health, and young people have been very open with them and honest with them about what they feel about mental health and how they cope, especially over the pandemic, with mental health and how they relate to and talk about these issues. But they also offer us a great perspective and information and data and all sorts of stuff along mental health. So they can feed back to us about whether we're doing things in an up-to-date way, whether we're reaching out to our young people in the best way, and how we're framing the conversations about mental health. They have a lot of inside information, I suppose.
Often in research, you do the work, you produce a paper, it sits in a journal, and it gets no further than that. Something that we really want to try to do better at is translating the evidence, the research we're doing, into policy, into real life impact. Last summer we ran a 3-day conference together with young people and community groups and so on, to bring together all of the evidence around the impacts of COVID on young people's mental health. And at the end of that 3-day conference, then we had representatives from key stakeholder groups, which included young people, people from schools and senior leadership teams in education, local authorities, charities and so on, come together for what's called a policy lab, where you basically aim to distill that evidence into a set of recommendations for policymakers, which has come not just from researchers, but from young people, from schools, from communities, from charities and so on.
I think one of the ways in which the Centre can make a real contribution is to actually be very focused on identifying areas where reform is needed. We identify the inequalities, but then making sure that this is something that gets reformed, helping people to see ways in which they can take action. And that is at multiple levels, and I think that the Centre can really be that source and that model of how that's done.